If I could just remind you to kindly please mute your microphones so we can get the system working. At 1 p.m. today, we will be issuing a policy brief from the Secretary General looking at the impact of the COVID-19 pandemic on children, which highlights the risks they face. The report looks at issues such as education and food security. The policy brief also addresses issues regarding safety, including domestic violence, abuse, and the growing risks children are facing as they spend more time online. Here in New York, Martin Griffiths, the special envoy for Yemen, briefed the Security Council, and he briefed it remotely from Jordan. He told them that an opportunity has emerged to bring peace to Yemen when the arrival of the pandemic threatens to bring deeper and more widespread suffering to the people. He said there cannot be a more timely moment for the two parties to commit to silencing the guns, ending the conflict through a peaceful political solution. Following the call of the Secretary General for a ceasefire, Mr. Griffiths presented proposals to the two parties, the first on a nationwide ceasefire agreement and the second on key humanitarian and economic measures. Over the past 2 weeks, he said, he has been in constant negotiations with the parties on the text of these agreements and expects them to agree and formally adopt these agreements in the immediate future. Mr. Griffiths added that Yemen cannot face two fronts at the same time, a war and a pandemic. The Emergency Relief Coordinator, Mark Lowcock, also briefed the Security Council and said that more than 5 years of war have severely degraded Yemen's infrastructure, exhausted people's immune system, and increased acute vulnerabilities. As a result, he said, epidemiologists warned that the COVID-19 virus in Yemen could spread faster, more widely, and with more deadlier consequences than in many other countries. Mr. Lowcock said the UN is working with all stakeholders to take precautions to reduce the risk of the virus while maintaining life-saving assistance. He warned that funding for the aid operations is running out. As the UN's 41 major programs, 31 will start closing down in the next few weeks without additional funds. And turning to the WHO, this morning, Dr. Tedros, the head of the World Health Organization, along with the executive director of UN Women, Phumzile Mlambo Nduka, spoke to the UN resident coordinators who are leading the work in 162 countries and territories to help governments combat the spread of the virus. Dr. Tedros stressed that coordination at the country level is now the most important part of our work, adding he was proud that the whole UN system is coming together to support countries and leave no one behind. For her part, the head of UN Women emphasized the need to address the needs of women because they are disproportionately affected by the pandemic. She noted that 70% of women in developing countries are in the informal sector and that women who work in hospitals are infected at higher rates than men. She also reiterated how the pandemic could reverse the limited progress made on gender equality and women's rights, including increased rates of violence against women. A report published yesterday by the World Tourism Organization shows that as of April 6th, 96% of worldwide destinations have introduced travel restrictions in response to the pandemic. The Secretary General of the UNWTO, Zura Polishkashvili, said that the pandemic has impacted travel and tourism like no other event in history. He added that with tourism suspended, the benefits the sector brings are under threat and millions of jobs could be lost. More information is available on their website. And now turning to some of the country-specific updates we've been highlighting. The UN team in 10 countries, including Barbados and other countries in the Organization of Eastern Caribbean States, have put together a preparedness and response plan for the Eastern Caribbean nations. All of these countries have confirmed cases of the virus, and the new plan addresses immediate health needs and the broader social and economic impacts of the pandemic. Many of these economies being small, vulnerable, and heavily dependent on tourism. The UN system has set up an interagency task force comprising of the Pan American Health Organization, the UN Development Program, UNICEF, and the UN Office for Project Services, and all under the guidance of the UN resident coordinators. This is to boost our efficiency in purchasing quality products at better prices, including personal protective equipment, testing kits, and ventilators. And an update from Nigeria, where our colleagues tell us that they have received the delivery of vital supplies to fight the pandemic. The supplies, which were sent on a flight funded by the company APM Terminals, include 10,000 testing kits, 15 oxygen concentrators, personal protective equipment, and vaccines. More supplies are expected to be delivered in Nigeria in a UN flight in the coming days. And with over 260 cases of COVID-19 now confirmed in the Democratic Republic of Congo, the humanitarian coordinator, David McLaughlin-Carr, has allocated $10 million from the country's humanitarian fund to support joint preparedness and response activities. The funds will be used to raise awareness about the pandemic in vulnerable communities. They will also support efforts to foster community participation and engagement in prevention activities, as well as to facilitate access to sanitation infrastructure in areas affected by the disease. Activities primarily targeted with this new funding will include health, water, hygiene, and sanitation, as well as protection. And turning to Burkina Faso, where a fragile national healthcare system and massive displacements are increasing the risk of the spread of the virus. Almost 1 in 4 health centers, that's 24%, is either closed or not functioning in areas with humanitarian needs related to the conflict and other factors. As a reminder, almost 800,000 people are currently displaced in Burkina Faso, and this is challenging our epidemic control and response efforts. The UN's humanitarian country team is engaging with the government to ensure safety and continuity of the humanitarian response. The Central Emergency Response Fund has earmarked $4.1 million for the country from the global COVID SURF allocation of $75 million announced on March 25th. Burkina Faso is the West Africa country with the most impacted by the pandemic, with 8 out of 13 regions affected. As of today, 542 cases have been confirmed and 32 deaths recorded. Turning to Bangladesh, at the request of the government of Bangladesh, the UN Refugee Agency and its partners there are currently providing shelter and assistance to close to 400 Rohingya refugee survivors who disembarked from a boat in the Bay of Bengal this morning. The Refugee Agency says it heard from those on board the ship that some 30 more refugees may have passed away at sea as the boat ran out of food, water, and fuel during a nearly 2-month-long journey at sea. The survivors, who include a large number of women and children, are all in weak physical condition, many dehydrated and malnourished and in need of immediate medical attention. Despite some media reports claiming that the group may be infected with the COVID-19 virus, there's currently no evidence to substantiate these reports. And the UN Interim Security Force for Abyei has strongly condemned the attack by an organized Misraya armed group on Mabok village in southern Abyei on April 13th. 4 Ndok Dinka people were killed and 2 children kidnapped, while some 50 homes were burned down. The mission is saddened that the recent attack happened despite its efforts to promote peaceful coexistence between the communities. The UN mission had recently facilitated meetings between the Ngok Dinka and Misraya traditional leaders on the 16th of March and 9th of April to de-escalate tensions between the two groups. More worrisome, the mission said, is that this attack happened at a time when the world is united to fight the virus, and cautioned that it could reverse the gains made over past few years in the peace process in Abyei. And so far, 81 member states have paid 2020 budget dues in full. And we want to say thank you and welcome the latest payment by Brunei Dar es Salaam. They paid $695,334. And I'm sorry to end on a sad note. In this virtual room, I can't see all your faces together, but if I could right now, I'd look to my right to see one more time the seat where our friend and colleague Anne Charles would sit. I'm sad to report that Anne, who had been a long-time reporter for the Baltic Review, has passed away. As you might know, she had been part of the UN press corps since 1988, focusing on human rights, press freedoms, the treatment of minorities and other subjects concerning the Baltic states. Just recently, in 2018, she was awarded the Silver Medal of Merit from Viatus Magnus University in Lithuania for her contribution to the country. I will miss seeing her ready smile and her friendly face as she brightened up the press briefing room and our lives. We send our condolences to her family, and we have contact numbers for her family if you wish to contact them. Okay, let's now go to your questions, for which I need my glasses. Pam Falk.
Hi, Steph. Quick question on follow-up to the WHO fund cutting by the U.S. Any further comment from the Secretary General on impact or on a message to the international community? The Gates Foundation just gave $150 million to offset some of the loss. Do you have any other commitments from the UN itself, not from the, not referring us to WHO, that you know about?
The statement the Secretary General put out after this announcement, I think, could not have been clearer. This continues to be our opinion. We obviously welcome the gift, the additional funding from the Gates Foundation, and I think, as WHO said today or yesterday, they are assessing the impact and looking at funding issues.
Thank you.
All right. Let's go to my list from our trusted assistant, Edie. Edie?
Thank you very much, Steph. I'm sitting here in shock about Anne Charles's death. She was a very good friend, and I think that probably 50 or more pictures I have of myself at UN events are from her, but she was a warm and wonderful person. Come back to me.
Okay, will do. So, Abdelhamid. Abdelhamid.
Thank you, Steph. I have a question on Palestine. There is a letter addressed to the President of the Security Council that states that between 5th of March and 5th of April, Israeli authorities demolished 47 Palestinian structures, arrested 267, conducted 238 raids, and killed 3 Palestinians. They arrested the Minister of Jerusalem Affairs, Mr. Fadi al-Hidmi, and they arrested also the governor, Palestinian governor of East Jerusalem, Adnan Ghaith, and they just because they acted to help Palestinians in East Jerusalem to cope with COVID-19. So Israeli took that as interference of their sovereignty over Jerusalem. If all these incidents did not worth a special statement from the Secretary or his special envoy, then I wonder when Mr. Mladinov issue a strong statement to at least to curtail the Israelis of taking advantage of
Hamid, with all due respect, I have not seen the letter. Let me take a look at it, and I will get you. I will get back to you and work with Mr. Mladinov. Michelle.
Okay.
Michelle from Reuters. All right, see if you can work your mic. Otherwise, we'll come back to you. Samira from IPS.
Hi, Stephane. Thank you very much. My question is about the Rohingya refugees who have been rescued in Bangladesh, and you mentioned that no one has yet been, like a case of coronavirus has not yet been detected. But does UNHCR have all the proper resources to test all of them, and are they also being placed with other refugees at this time, or there are other measures being taken?
I think as far as I understand the information I got from UNHCR, they are they're not. They have not been moved to any refugee camp. They're getting the medical attention that they need. And I think there were rumors, as there often are in these cases, that they were tested positive. But as we said, they have no. UNHCR, I think, was very clear in saying, as far as they knew, that was not true. But obviously, they're being watched. They've been watched medically.
All right. Thank you.
Okay. Oscar Bolanos. All right. If you can't turn on your mic, I have a question from Michelle at Reuters asking for latest information on discussions on Afghanistan. What I can tell you is that today the UN Secretariat convened a discussion with member states on regional efforts to support peace in Afghanistan. Afghanistan, China, Iran, Pakistan, Russia, Tajikistan, Turkmenistan, the United States, and Uzbekistan all participated in this meeting, which was held virtually. The format brought together Afghanistan and 6 neighboring countries, plus Russia and the United States, in recognition of the importance of the region to Afghanistan's stability and sustainable development. The discussions focused on a comprehensive peace process in Afghanistan through intra-Afghan negotiations, and on the importance of regional cooperation in support to Afghanistan. Participants expressed solidarity with Afghanistan in its quest for peace, security, and prosperity, and echoed the Secretary General's call for a comprehensive ceasefire, especially in light of the urgent need to combat the spread of the virus. The United Nations stands ready to deliver life-saving assistance to people in need and is committed to the peaceful development of Afghanistan. Edie, please.
Thank you, Steph. A couple of questions. Can we get updates on contributions to the funds that the Secretary General has announced? And
yes.
Okay.
Go ahead. No, go ahead. Any other question?
Yeah, I don't know whether I was the only one listening to the Security Council this morning on web TV who had very bad sound, but you might want to tell the engineers that I see a few of my colleagues shaking their heads, like Maria. I mean, yeah.
Maria's always shaking her head, but we will check and pass on your remarks. We do want to. I mean, I think everybody's making efforts to make these systems work, and we will do that. On the humanitarian,
I want to tell them the sound was coming, like he'd say 3 words and then we'd hear it again. Okay. So it was like doubling over.
Will do. On the humanitarian response plan, as of the 14th of April, the fund had received $393 million. The trust fund, I don't have the figures with me, but what I will do is we will circulate by email the websites for both these funds, because the funds are being updated on a daily basis, and you can just check the money as it rolls in, or as it hopefully rolls in. I have a question from Iftikhar, Associated Press of Pakistan. The new Rohingya arrivals in Bangladesh, will the UN call on Myanmar to respond to the SG's appeal? I'm not sure I fully understand the question, but if I'll take a stab at it, that the Secretary General does appeal for ceasefires and cessation of hostilities globally, and I think the Secretary General's position on Myanmar and the situation and the need to address the underlying causes of a lot of these issues in Rakhine State remains unchanged. Oscar asks, the Secretary General appeals to fight against the pandemic or in solidarity and cooperation, but in practice, we're seeing how some positions are far from the reality of the world we're facing with the common enemy. In this regard, how can the UN help? What mechanisms should apply to mobilize the unity of the world to protect against pandemic? Well, the Secretary General's call for a global ceasefire, for unity and solidarity, is being constantly reiterated. One mechanism is for global support to the World Health Organization, which is leading our fight on the medical end and on the public health end to the virus. And second, we look forward to seeing the legislative bodies of this organization also come together and speak with one voice in our global efforts and our efforts rooted in solidarity to fight the virus. Unless Florencia tells me otherwise, I think I have run through my questions. That's it. So we shall see you next time around. And thank you all. Bye.